How does pelvic floor PT treat bladder prolapse? Have you ever wondered how pelvic floor physical therapy can help with bladder prolapse? Bladder prolapse occurs when the pelvic floor muscles and connective tissues weaken, causing the bladder to descend or bulge into the vagina. Pelvic floor physical therapy, often referred to as PT, focuses on strengthening and retraining these crucial muscles to provide better support for the bladder and other pelvic organs. One of the primary ways pelvic floor PT treats bladder prolapse is through pelvic floor muscle strengthening. This often involves targeted exercises, commonly known as Kegel exercises. These exercises help to increase the strength and endurance of the pelvic floor muscles. When these muscles are stronger, they can better support the bladder, which can reduce the degree of prolapse and alleviate symptoms like pelvic heaviness or pressure. Another important aspect of pelvic floor PT is muscle coordination and control. During therapy, patients learn how to properly contract and relax their pelvic floor muscles. This retraining is essential for improving the ability to support pelvic organs during activities that increase abdominal pressure, such as coughing, lifting, or exercising. By mastering these techniques, patients can help prevent the worsening of their prolapse. Functional movement and posture training are also key components of pelvic floor PT. Therapists assess and work on improving posture, breathing patterns, and movement mechanics. Proper control of intra-abdominal pressure during daily activities can help reduce excessive strain on the pelvic floor. This not only aids in symptom relief but also supports better management of the prolapse. Education and lifestyle modifications play a significant role in pelvic floor therapy as well. Patients receive guidance on bladder and bowel habits, fluid intake, and toileting positions. These adjustments can help minimize factors that worsen prolapse symptoms or increase strain on the pelvic floor. Additionally, pelvic floor PT can address related issues such as urinary incontinence, which often accompanies bladder prolapse. By enhancing muscle function and bladder control, patients can experience improvements in these areas as well. Pelvic floor physical therapy is considered a first-line, non-surgical treatment option for bladder prolapse and other pelvic floor disorders. Typically, therapy is delivered over several weeks, with individualized exercise programs and manual therapies tailored to each patient's specific needs. While pelvic floor PT may not reverse advanced prolapse, it can significantly reduce symptoms, improve quality of life, and potentially delay or prevent the need for surgery. From a bladder health perspective, maintaining the structural integrity of the pelvic floor is crucial. This support helps prevent complications such as urinary retention or incontinence that can arise from prolapse. For those with or at risk of bladder cancer, preserving pelvic floor function is vital for overall urinary health and recovery after any bladder-related treatments. In summary, pelvic floor physical therapy treats bladder prolapse by rebuilding the strength and coordination of the pelvic floor muscles. This comprehensive, evidence-based approach includes exercise, education, and functional training, making it a safe and effective management strategy for bladder prolapse. Always consult with a healthcare professional to determine the best treatment plan for your specific situation.